Good afternoon and welcome to the Massachusetts eHealth Institute's Behavioral Health eQuality Incentive Program, or eQuip, introductory webinar. In today's webinar, we will present an overview of the eQuip milestone requirements, including the completion of the AMRAM survey. The HIMSS Analytics will review the AMRAM survey and the resulting AMRAM scoring and gap analysis. We will also review the requirements of the Milestone 1 Transformation Plan that must be approved by MeHI and present an overview of the highway use cases and available resources. Finally, this webinar will likely run for the full hour. We ask that you please submit any questions to the MeHI eHealth eQuality inbox, which is eheq@masstech.org. My name is Vivian Chung. I'm the eHealth Equality Grants Coordinator, and with me from MeHI are Olivia Jaflin, the eHealth Programs Coordinator, and Keely Benson, eHealth Community Manager. With us as well as from HIMSS Analytics is John Daniel, Global Vice President of the Healthcare Advisory Services at HIMSS Analytics. Now we will provide a brief overview of the eQuip program. As you may recall, the goal of the eQuip program is to help guide selected behavioral health organizations to increasingly sophisticated use of health IT, or progress through the health IT maturity cycle. Program incentive funding will assist grantees with the adoption and implementation of certified EHR technology, or CERT, and system implementation and interoperability through connection to the Massachusetts Health Information Exchange, or the Mass Highway. This grant program will help prepare the behavioral health sector for exchange of information to support larger community health statewide efforts. Requirements of the eQuip grantees include use of certified EHR technology. While CERT is not required to meet eQuip Milestone 1, it is required to meet the other program milestones. The use of CERT does not guarantee interoperability, but certification does help ensure that the EHR will provide standard-based functionality that will support interoperability. Thus, it is important to have discussions with your vendor about EHR system capabilities as it relates to the functionalities described in the milestones. You are also required to complete and submit the HIMSS AMRAM survey, which we will discuss in more detail during this webinar. Additionally, you must complete all grant deliverables related to milestone 1 through 4, commit to achieving all 4 eQuip milestones, and submit reports and attend our grantee in-person events. This slide provides a quick reference to program milestones. Grantees will be paid 25% of the total incentive for each milestone achieved. Note that milestones must be completed sequentially, with the exception of milestone 4, which may be met at any time after milestone 1. Today's presentation will focus primarily on the HIMSS AMRAM model and milestone 1 requirements. As shown in the previous slide, this provides an overview of the HIMSS AMRAM stages necessary to meet the program milestones. For the purposes of this program, please note that you are only required to meet stage 5 during the program duration, but achieving to stage 7 is encouraged. Now I would like to introduce John Daniels, Global Vice President of Healthcare Advisory Services at HIMSS Analytics. John will provide an overview of HIMSS, the AMRAM model, survey, and gap analysis.
All right, hello everyone, welcome, and it's an honor to be here with you this morning, or this afternoon, I should say. Patty Harris is my colleague who helps with this project, and she's out on travel today, not able to join us, but she is the primary point of contact, if you will, for any questions related to data collection and any questions around the survey and that sort of thing. So she'll be your primary contact there, and you can see her email address as well as her phone number for those questions. You've also got my email address on here as well as my phone number in case you're not able to get in touch with her. But I seriously doubt you'll have any problems connecting with Patty because she's very responsive via email. She's very quick when she's in the office, so that should not be an issue. Let's go to the next slide. Okay, so what I'm showing you here right now is a high-level overview of the HIMSS Analytics Ambulatory EMR Adoption Model. A little bit of background about the model. It was originally developed around the 2012 timeframe, and we have developed a hospital acute care EMR adoption model that was developed around the 2004 timeframe. Around 2012 or before that, we decided it was time to also build a model that could help serve as a roadmap, an aspirational roadmap for ambulatory organizations who were on a journey to implement advanced EMR capabilities and technologies. So we answered the need of the market through developing this separate ambulatory EMR adoption model that truly does provide a roadmap, an aspirational roadmap, if you will, for ambulatory organizations. Initially, it was developed primarily for ambulatory practices that were tethered or associated with hospital or integrated delivery systems, but the model is just as effective and useful for those practices that are not tethered or associated with a hospital or a health system. So this is the model here. It basically is an 8-stage model that runs from stage 0 to stage 7. And it progressively adds EMR capabilities as you move up the stages from 0 to 7. At stage 0, the practice basically operates off a paper-based chart. So the documentation of a patient is done on paper. The medical record is purely on paper. Any medication orders or non-medication orders are typically done on paper. Pretty much everything is accomplished on a paper-based medical record system. As a practice begins to implement EMR capabilities, they're able to move up the stages of the EMR adoption model and be able to be scored and represented at the various stages. So for example, when a hospital or a clinic begins to use computers to provide the physicians and the nurses access to clinical information in the clinic, and it's okay if it's unstructured data, and they may have multiple places where they go to get information, but basically just a single desktop access to information on the internet or to other data sources would represent a clinic at stage 1 of the model. Moving into stage 2, we see the beginnings of an electronic medical record system through the implementation of what we call a clinical data repository. And this is basically a database or a repository where all of the orders for a patient might be entered and the results would be stored. And then the clinic may also have some point of care devices, such as a laptop or maybe a computer in the exam room, so that the nurse is able to perhaps do some documentation, or perhaps the physician is able to do enter some orders electronically if possible, but certainly being able to use the computer to access those results that might be stored within the clinical data repository, whether those results are produced from within the clinic or whether those results may come from external facilities, such as diagnostic centers, if you will. At stage 3, the clinic may be adding some electronic messaging capabilities. They have basically replaced the paper chart with a computer, and they're using the online electronic medical record and the capabilities that the CDR brings to bear as their primary documentation capability. So rather than writing notes on paper, they're beginning to document notes in the computer in the electronic medical record. But there's also a sort of the beginning stages of a clinical decision support capability, particularly from orders, where the computer might be making recommendations on orders based on perhaps a condition that the patient has presented with in the clinic. So there's a very basic clinical decision support capability that's included at stage 3 of the model. At stage 4 of the model, we begin to see computerized practitioner order entry, or CPOE, which allows the physician perhaps to do some e-prescribing, where they're entering orders for medications or non-medications in the computer system. And those orders then are transmitted to where they need to go, for example, perhaps to a pharmacy or to a diagnostic service that the clinic might offer. But those orders are transmitted electronically and need for paper orders to be written. Also at stage 4, we're beginning to see the use of structured data within the electronic medical record, where you're able to store data in a structured format and being able to access that information internally and externally, and being able to share some of that data with other organizations or other clinics internally or externally. At stage 5, we see the implementation of a patient portal, or a personal health record, if you will, where you're providing the capability for your patients to log on to their own account within the portal and view any medical summaries that you have on them in their electronic medical record. So in this case, some of the capabilities that we like to see included in the patient portal is being able to access certain information within their medical record, perhaps being able to access results from lab tests or results from imaging, or being able to message their provider and being able to communicate with their physician or their provider as part of the portal as well. Some of the other capabilities that we'd like to see included in the portal would be the ability for a patient to request or schedule an appointment, the ability for the patient perhaps to pay their bills to the provider through the portal, and then some form of educational content or other content that the patient might be able to access through the portal based on any problems or diagnoses that have been associated with them in their medical record. So that's, in a nutshell, is the personal health record or the patient portal capability that we'd like to see at stage 5. Now, as we move on up into stage 6 and stage 7, we truly begin to see the more advanced capabilities of clinics at these stages. So, for example, at stage 6, when a physician is documenting care in the medical record, in the electronic medical record, we'd like to see an advanced clinical decision support capability where the system is actually providing advice or recommendations to the physician based on something the physician has documented. So, for example, if the physician adds diabetes to the patient's problem list or diagnosis, then there might be a rule that would be triggered by that diagnosis that then presents to the physician in the computer when they're seeing the patient that says, hey physician, you've just added diabetes to the diagnosis list, but this patient hasn't had an eye exam, they haven't had a foot exam, or there's no current blood sugar test result listed in their medical record. So the recommendation would be to, order a foot exam or perhaps an eye exam, or at least order a blood sugar, glucose lab test, or you might even have a device in the office that allows you to run the blood sugar yourself. But at least the system is being proactive and providing some measure of advice or clinical decision support to the physician to help with their decision making around the patient's care that's being provided. And moving on to stage 7, not only do we expect to continue to see that advanced clinical and decision support capability, but then at stage 7 we begin to look at the the pervasiveness of use of the EMR within the practice of the organization. So, for example, at stage 7, we want to see that all of the clinics that are operating under the organization's umbrella are using the same sorts of capabilities, that all of the physicians are using the EMR, they're entering orders in the EMR, and they're getting clinical decision support from the EMR based on documentation that they've been entering. But we also want to see that the organization is able to share information externally with other entities. So, for example, with the Health Information Exchange, the Mass eHighway, I believe as it's called, does participate in the Mass eHighway, and what information are they sharing so that if a patient is being seen in the emergency department or a hospital that's also connected to the Mass eHighway, would that hospital physician or the ED physician be able to see and access the critical information that might be available about that particular patient, such as allergies or medications the patient might be on that have been prescribed by the ambulatory practice, or any other such information. We want to verify that exchange capability is possible. The other area that we look at for stage 7 is, now that you've built this electronic medical record system and you're using this electronic medical record system to provide care to the patient, how is the organization using this data that's being collected in the EMR to drive decision making for the organization? So we classify that under business and clinical intelligence, where we're looking at their analytics capabilities. How are they using this information that's being collected in the EMR, as well as any business or operations information, combining that information together and doing their own analytics internally to help drive decisions in the organization in terms of any process improvements or best practices they might be able to implement based on some issues they've discovered by doing their analytics of the data that they've collected about their patient population. How are they managing their patients that have chronic diseases? So if you have a patient population that seems to have a prevalence of diabetes diagnoses, then looking at your entire population of patients with diabetes, how are you able to manage that population to ensure they're all getting the care that they need prescribed by protocols associated with the diabetes diagnosis? So in other words, can you look at all of your patients across the practice and see how many of them have had the appropriate foot exams, the appropriate eye exams, and have regular blood sugar checks and that sort of thing, and then identify those that may be falling through the cracks, and being able to proactively reach out to them then and encourage them to follow through with the recommended treatment protocols and monitoring of that particular diagnosis. So diabetes is just one example, but we like to see how the organization is using their data to help care for and improve the health status of the patients within their particular patient population, if you will. That's basically the overview of the model. The numbers that I'm showing you on this particular slide tells us where the market is in terms of where clinics typically are falling within the EMR adoption model. When we launched the model in 2012, we had about 9,247 clinics that we had collected data on. And based on that data, we saw that there were, more than 50% of the clinics were at between stages 0 to 2. And then as we collect more and more data from more and more clinics, we can see those numbers change. And if you fast forward to the end of the second quarter of 2015, you can see that the majority of the hospitals, or clinics, my apologies, are still within that stage 1 and 2 area, even into stage 3. But we also can see that there have been several ambulatory practices that have now achieved stage 7 of the model. even though we have this algorithm that scores clinics on the EMR adoption model, it only goes up through stage 6. The stage 7 designation results in an on-site validation visit by HIMSS Analytics subject matter experts. So when a hospital or when a clinic scores stage 6 on the model, we will actually spend some time working with that clinic and validating that they do indeed have those stage 6 capabilities that we require. And if they meet our requirements, then we will designate them as a stage 6 clinic. Same thing for stage 7. However, at stage 7, it's an on-site validation where we will actually go and visit some of the clinics within the organization and actually observe how the technology is being used, and we will ask lots of questions about how the information is being used, as well as what are the processes being used and how are you improving the population and improving the organization through the use of the EMR. And we'll want to see that the evidence of all of these capabilities. And as long as the clinics and the organization is able to satisfy the requirements based on our on-site review, which lasts about a day, then we can designate them a stage 7 organization, and that's how they get to stage 7. So you can see at the end of the second quarter of 2015, we have just over 34,000 clinics included in these numbers. So it's becoming more and more representative of the U.S. ambulatory market in terms of, on average, where are the clinics in the U.S. Ranging or sitting on the EMR adoption model. So it's a nice measure of where the market is. And of course, once your data is collected, it will be aggregated into these numbers to continue to reflect where the market is in terms of EMR adoption. So let's go to the next slide now. In terms of the timeline and the process for data collection, I want to quickly just run through this briefly. And you can read the slides, but generally what we'll do is work with MeHI and the individual clinics to collect their data. You will receive a specific login to our database or online survey tool that will allow you to go on and complete the survey online. So you'll get login credentials to do that. And then once that is completed, we'll want you to notify MeHI that you've completed the survey, and then we will be notified. And then at that point, once the survey is complete, we can look for any gaps in the data, and this is where the QA process comes into play. So we have a team that will QA the data that you've entered, and if there's any gaps or any questions about the data that you've entered, we'll reach out and try to get clarification on any gaps or missing data. And then once the QA process is completed, then we will run your data through our scoring algorithm to tell us what stage you're at on the EMR adoption model. And then we should be able to produce a gap assessment report that would then identify not only what your score is, but also any gaps that might be that are apparent in terms of moving up the EMR adoption model and eventually getting to stage 6 and stage 7. If there's any questions about the EMR adoption model or what capabilities we're looking for, perhaps even on how to answer some of the questions, we have trained and certified MeHI as a certified educator on the ambulatory EMR adoption model. So they are more than prepared to answer any questions you might have about completing the survey as well. But then again, of course, you've always got Patty available, and MeHI knows this as well, that they can certainly reach out to Patty if there's any questions whatsoever. We want to try to make this as easy as we possibly can for you, and we want you to be able to use the information to help you as you embark on this important journey. So next slide, please. Here's a graphic, if you will, of the survey process. The contract, of course, with MeHI is once the contract is finalized, then you will get an email from MeHI to begin the survey, and then you should notify us once the survey is completed. It'll go through the review process, and if there's any holes or any questions that need to be filled, then we will notify MeHI and work with MeHI and you to fill in those goals or those gaps. And once the survey is completed and it passes QA, then that's when we get into the gap assessments and the scores, and then we deliver the reports back to you. So it's important that we complete the surveys accurately, of course, and certainly in a timely manner so that we can get you the scores and the result and the gap assessment as quick as possible. Next slide. If you want to know what the survey looks like, I'm providing you with a sample survey link here, and this is the username and the password that you can use to log in to that particular sample survey, and this allows you to go in and it's like a sandbox. You can go in and play in the sandbox and get a feel for how the survey works and what it does and what types of questions we're asking. It will probably give you an opportunity to perhaps formulate any questions that you might have in advance if you're not sure about some of the terms that we might be using, or which questions to answer, which ones apply, which ones don't apply, and so forth. So that kind of gives you an advanced opportunity to prepare yourself for completing the survey and the process. Of course, the key stakeholders to help in completing this actual survey could be one person in the organization or the clinic, but it could be multiple. But the person who needs to complete the survey would be someone who's familiar with all the systems that are installed, the EMR system as well as the patient portal. You might have some clinicians that are familiar with the documentation process and the build out and how clinical decision support may be used within the organization that could help fill the survey. And then any processes associated with the health information exchange. Whoever you have on your team that is working with that health information exchange process, they may also be a good resource for helping you complete the survey too. So there's some good points for you to consider there. Next slide, please. This is just a screenshot of what the survey tool looks like. And the score that we print, that we give you, will be facility specific. So if you have multiple facilities, multiple clinics within your organization, each clinic will get their own score and report. And I just wanted to make sure that that's very clear, that it's not going to be an organizational score and gap assessment. It'll be a facility score by clinic as well as the gap assessment. Next slide, please. And this is just another sample screenshot of some of the survey questions. There'll be drop-down menus that will certainly make it easier for you to complete. You'll have the opportunity to edit these until it's finally submitted. So we think that the survey tool is very useful, very user-friendly, but again, if you have any questions or not sure what to do, then obviously you've got your MeHI team to reach out to for support, as well as Patty if needed. Next slide. This is what the gap assessment report may look like. We'll tell you what the score is, as well as telling you in this format what the gaps are, so that it's very clear to you where you are towards meeting the MRAM, the ambulatory MRAM stage requirements. So again, this is just a sample of what it looks like. So that's an overview of the ambulatory MRAM, as well as the process of how this would be completed. I don't know if we're going to have time for Q&A today, and because Patty's not here, I may not be able to answer all of your questions. She's the one that's on the ground doing the detailed data collection, support, and QA process. So she will be available very soon, within a few days. But again, you've got the MeHI team. They've been trained, they're certified, and they've been through this process already once before, of course, and so they know very well how this process works and how to answer a lot of the questions. So I would encourage you to rely first on them, and then, of course, if they need some clarification, then we've got a great working relationship, and we'll be able to continue to work together to make this successful for you. So that's my presentation, and I'm going to hand it back to the MeHI team.
Thanks very much, John. That was helpful. And like John mentioned, should you have any questions, reach out to us, and we'll be providing more information about the survey in emails to come. So now we'll provide an overview on Milestone 1 for the EQUIP grant. So Milestone 1 requires submission of a comprehensive transformation plan and a highway use case, both of which need to be approved by MeHI. The transformation plan must demonstrate how the grantee will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve its identified outcomes. Now, this transformation plan should be a detailed organizational action plan to advance interoperability and achieve the remaining 3 milestones in each of your care facilities. It's key that your transformation plan focus on implementing interoperability functions of Milestone 2, so MRAM stages 1 through 3, and Milestone 3, MRAM stages 4 and 5, in all of your clinical care facilities that you submit to the MRAM survey. You will receive a score and gap assessment for each of these facilities. Milestone 1 also requires grantees to complete the MeHI HIE Use Case Development Forum, which specifies how you intend to connect to and use the Mass Highway. Keely Benson will review this information later in the presentation. The deadline to submit your Milestone 1 documents to MeHI for approval is Thursday, December 17th. Grantees will receive a transformation plan template via email in the coming weeks. This slide details the transformation plan elements that are necessary in order to be approved for Milestone 1. Details of your organization's approach to advancing interoperability, as was originally outlined in your proposal narrative, should be updated and then incorporated into the transformation plan. We know that there's an amount of thought and detail that was included in the narrative submitted with the original applications, and we anticipate that the transformation plans will elaborate and build on those ideas. Your proposal narratives can be thought of as a starting point, and any significant changes or deviations that were previously submitted should be highlighted and explained. So the transformation plan should include an updated expected project cost and timeline to reach each milestone if this has changed from the original narrative. It should also include a detailed explanation of how your organization will support efforts to integrate behavioral health services with other patient care settings, an updated description of the resources your organization intends to provide to supplement EQUIP incentive payments, including leadership support, any changes to how the receipt of this incentive payment will help achieve long-term benefits to the Commonwealth and meet the state's healthcare policy goals, and how your organization plans to address anticipated challenges and problems that may occur in meeting the milestones. This slide also includes specific sections of the transformation plan. The transformation plan will describe how your organization will prepare and transform its practice to maximize the potential of its investments in health IT. At a minimum, the plan must include the anticipated outcomes from this project. So grantees will specify operational and clinical outcomes being targeted, for example, discharge summaries sent electronically, at least one measure of which should be tracked monthly, and how these outcomes will result in better integration of behavioral health with other settings of care. This transformation plan will also include a grant approach detailing the organization's plan for the eQuip milestones, integrating aspects such as how the organization plans to meet each milestone, how the advancement and use of health IT will support achieving identified operational and clinical outcomes, and the strategy, policies, and procedure it will employ to ensure privacy and security of the patient electronic health information. This slide is a continuation of the transformation plan elements that are necessary. You will include a description of your organization's current state of health IT, as well as its future state as the program concludes. Details of the AMRAM gap assessment findings produced by HIMSS should also be incorporated into the transformation plan. And finally, the plan should contain a timeline of the major activities required to achieve the organization's future state and identified outcomes. The timeline should include dates it expects the organization to meet the requirements for milestones 2, 3, and 4. The plan is expected to be comprehensive and demonstrate a thorough analysis in extensive detail. In order to achieve milestone 1, MeHI must approve a grantee's transformation plan. We may request revisions and modifications prior to the approval. This slide shows our EHR planning and procurement toolkit. It's a great resource located on our website. It's for organizations without an EHR or thinking of switching systems. It can be found at mehi.masstech.org in our toolkit section. The toolkit provides a guidance and customizable collateral material to help you through key phases, the pre-solicitation and preparation phase, the vendor solicitation phase, vendor evaluation and selection phase, and finally the vendor relationship management. We strongly encourage your feedback on this toolkit and invite you to submit your comments and suggestions about the collateral materials associated with it. Now I'll introduce Keely Benson, eHealth Community Manager, who will provide an overview of the highway use cases.
Hello, everyone. So I want to spend a few minutes describing what a use case is and why we use them, and then we'll dive into the required elements to develop an effective use case. I will be providing some use case resources at the end of the presentation that will reinforce the concepts I'll be discussing. A use case is a simple narrative that describes how your organization will share patient information with another organization electronically. For health information exchange purposes, it describes the trading partners that will be participating in the use case. The trading partners are simply the organizations that will be sending and receiving the health information. It also describes how these organizations or trading partners will be using the Mass Highway. The Mass Highway, as we've described before, is the statewide health information exchange. So it will describe how you use the Mass Highway to send and receive the information. There are many benefits to developing a use case. First, use cases ensure that you've identified your clinical or business need before technical planning begins, which will limit changes or delays later on. They also help to scope a project, and they assist an organization with planning and prioritizing efforts. Use cases can also help to convey the value of your project to organizational leadership. And finally, they help to identify all of the stakeholders and team members involved in the project. When you begin developing your use case, it's important to start with a goal in mind. Next slide. Okay. So here we see the use case elements. There are 5 elements that should be included in the use case that each of your organizations will develop. We'll be reviewing a use case example in a few minutes, which will make each of these elements a little more clear. A description of each of these elements is also included in the use case development form that your organizations will be required to complete. First, you'll need a name. It should be simple, and we usually keep it to 100 characters or less. But it should be clear who will be sending the patient information, what they will be sending, and who will be receiving the information. The example we'll be reviewing in a few minutes is a referral request from a primary care physician to a behavioral health specialist. Next, you'll need to identify your end goal, which will include a brief description of what you are trying to accomplish. The story section should include context and information about how you will use the Mass Highway to send information to your trading partner and how they will receive the information on their end. The fourth element to include is trading partners and systems. As I mentioned before, the trading partners are the organizations that will be sending and receiving patient information. Grantees will be required to connect to the Mass Highway directly through their EHR, and this is information that should be included in the systems information. It's also important to remember that the EQUIP grant requires that trading partners be unaffiliated organizations. The last use case element to include is data to exchange. This will include the type of file or document that will be sent electronically from one organization to another. For example, it could be a summary of care record formatted as a consolidated CDA or simply a PDF. Next slide. Here's a diagram that is used to illustrate a use case, and it includes some of the use case elements I mentioned before. The use case name, which is at the top of the slide, is referral request from primary care physician to behavioral health specialist. The goal of the use case, listed at the bottom, is to improve specialty referrals to behavioral health providers by sending the information needed by a behavioral health provider to safely treat the referred patient. The diagram in the middle of the slide shows the trading partners, which are the primary care physician at an ambulatory practice sending information to a behavioral health specialist. This behavioral health specialist could be a clinical social worker, psychologist, or psychiatrist, for example. And the data being exchanged includes a referral document and a summary of care document, which includes a medication list. Next slide. Here is the same use case with all 5 elements laid out in more detail. Again, the use case name is at the top. Referral request from primary care physician to behavioral health organization. This is a hypothetical use case, so we're calling the first organization Ambulatory Practice A and the second organization Behavioral Health Organization B. The goal is included as it was in the last slide, but here we have more detail on the trading partners and systems. Organization A, which is the ambulatory practice, with a primary care physician being the primary sender of information, will use a practice-based EHR with a direct gateway to the Mass Highway to send information. Organization B, which is a behavioral health organization, will use an EHR also with a direct gateway to the highway to receive the information that is being sent from Organization A. The data that is being exchanged includes a referral document in a PDF format and a summary of care document in a CCD or continuity of care format. The story includes a more detailed description of the health information exchange that is taking place. The story, you'll notice, includes context, and the reader has a basic understanding about why the information is being exchanged. It also includes the steps that each of the trading partners must take to complete the health information exchange process. Next slide. Here are some additional use cases that may be of interest to this group. So the first is an admission request from a care provider, likely a clinical provider, of a behavioral health consumer to an inpatient facility. The second example is a summary of care document or treatment plan from a behavioral health specialist to a primary care physician. In this case, the behavioral health specialist could include a social worker, psychologist, or psychiatrist. And then the third example is a discharge summary from an inpatient facility to a behavioral health care provider and or social worker. Having this discharge information would help the behavioral health provider and social worker provide better care management to the patient. I want to point out that the use cases we've reviewed today, in the use cases we have reviewed, information is flowing in one direction. But your organization should also consider a two-way exchange in which both trading partners are sending and receiving information. And then this slide here just provides some use case resources. All of these links are available on the MeHI website. The first is the use case development guide, which provides information about the 5 use case elements we just discussed, and should come in handy as you complete your use case development form. The second link will take you directly to the use case development form, which is required for all grantees to complete as part of Milestone 1. And finally, there's a link to the use case library, which includes real-world use case examples as well as hypothetical use cases. It may be helpful to look at some of these examples before you begin to develop your own use case.
Thank you, Kaylee. Again, all of those resources may be found on the MeHI website. Now we'll review the program timeline and resources. So this timeline slide repeats some of the important dates related to the grant. Today we are holding the introductory webinar. On October 15th, you must have submitted the baseline survey to HIM. We will be sending out more information about logins to each grantee in the coming weeks so that you may complete this survey. You'll notice that in December of 2015, we will be holding our first and required grantee in-person forum. We'll be sending out a save the date in the coming weeks, but please plan for early December. On December 17th, Milestone 1 achievement or Milestone 1 documentation is due. You must submit your transformation plan and use case development form to MeHI. And as a reminder, our period of performance is September 1st of this year through June 30th of 2017. So here we have MeHI's eHealth program staff. Each eQuip grantee will be assigned to a specific person that will be your primary contact for the duration of this grant. They'll be available to guide you through the program milestones and answer any eQuip programmatic questions that you may have. Please note that MeHI will be shortly sending out a release about the eQuality Incentive Program grantees, which will include the names of successful organizations. We ask that you please hold off on announcing your participation in the program until the official announcement has been released from us. Should you have any questions on this webinar or the grant program, please submit them to the eHealth eQuality inbox. It's eheq@masstech.org. Additional resources mentioned in this webinar may be found on the MeHI website, which is mehi.masstech.org. Thanks so much for joining us on today's webinar, and we appreciate your participation. MeHI will be sending out the slide deck to all grantees, so don't worry, you won't have to remember all of this information. All right, thanks very much.